We're all human, and it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and welcome to Doctors Are People Too. Here on Monday, January 16th. I'm jumping the gun. 2017. I'm really excited tonight because we have a neuropsychologist on the program who's going to talk with us a lot about Parkinson's disease and also dementia, traumatic brain injury, and other areas of interest in neuropsychology. Dr. Nicholas DiPino is on the program. Like I said, he's a neuropsychologist, licensed psychologist with the Palm Beach Neuroscience Institute. That's PBNI in West Palm Beach. And now we're going to talk to him a little bit also on the program about his new office in Boynton Beach. And Dr. DiPino is on staff at St. Mary's Medical Center in West Palm Beach. Dr. DiPino, welcome to the program. How are you doing today?
Very good, David. Thank you for having me back.
And thank you for coming back on Doctors Are People Too. I know we had you middle of last year, so really excited to have you back on. And you have a big event coming up. It's the Comprehensive Approach to Parkinson's Disease Symposium here in neighboring Delray Beach next week. It's actually Saturday, January 21st at the Delray Beach Marriott, 8 a.m. to 4:30 p.m. Now, you're one of seven featured speakers, including yourself, in the program. Can you tell us a little bit about this Parkinson's Disease Symposium and what you'll be speaking on?
Yeah, so this is happening this weekend, and it's focusing on the comprehensive treatment approach and the team approach to treating and managing Parkinson's disease. So there's several different speakers from different specialties, from neurology, I think neurosurgery, physical therapy, speech therapy, and also neuropsychology. And I'm presenting on neuropsychological assessment for Parkinson's disease patients and how we evaluate and the different difficulties that patients have with Parkinson's disease that affect their thinking abilities as well as their mood and emotional functioning.
And are those the three main learning objectives in your presentation?
Essentially, yes. I'll be talking a little bit, kind of an overview of neuropsychology and what a neuropsychologist does, and talk about the different cognitive difficulties that Parkinson's patients may experience, as well as the mood and behavioral changes that can take place.
Can we give listeners a sneak preview? Do you know what time you're speaking at? I know it's between 8 a.m. and 4 p.m.
Yeah. I think my speaking is at 1 o'clock. I think it's from 1 to 1:50, somewhere around there.
Well, that's a perfect time slot. I've been to a lot of symposiums, and right after lunch, people have a little bit of energy, and they'll probably be asking you a lot of questions. But sometimes late in the day can be tougher. Early in the morning can be tough.
Right. Yeah, I'm looking forward to it.
You got the prime time slot there. That's a comprehensive approach to Parkinson's disease symposium. It's actually put on by the American Parkinson's Disease Association South Florida chapter here in South Florida, and also the Palm Beach Neuroscience Institute. That's pbni.com. There's CME credits available. I think it's 6, and the other featured speakers are Dr. R.F. Dalvey. He's a neurologist with Palm Beach Neuroscience Institute, specializes in movement disorders and Parkinson's disease. There's Dr. Michelle Ferreira, movement disorder neurologist. Matthew Green, a physical therapist. Alan Lazar, orthopedic surgeon. Michaela Muir, a speech pathologist. And Dr. Lloyd Zucker, a neurosurgeon who's on staff locally, I know, at Delray Medical Center for the Tenet Health Florida region. If you want to learn more about the American Parkinson's Disease Symposium, the website is apdaflorida.org, so you can learn a little more. And it's this Saturday, January 21st, 8 a.m. to 4:30 p.m. at the Delray Beach Marriott, 10 North Ocean Boulevard in Delray Beach. Now, we're talking about Parkinson's disease, but how does Parkinson's disease tie into neuropsychology? What can a neuropsychologist, what kind of things can they do to help with Parkinson's disease?
Well, often my role is to help determine if patients are having significant cognitive difficulties, which is common for patients with Parkinson's disease. At some point, they do develop cognitive difficulties, which can progress from mild to more severe, such as dementia. So my role is to help determine where they may be with that and to provide some helpful recommendations, as well as to assess their mood and emotional functioning for things like depression, anxiety, and other behavioral changes that can take place, and then offer some recommendations for helping to improve their functioning both cognitively and emotionally, and hopefully thereby it helps to improve their overall functioning as best as possible.
And do you make those determinations by testing and evaluation? Right.
So it involves intake with a history to get some background information and see what their current complaints are cognitively and emotionally, and then we conduct extensive neuropsychological testing, which is paper and pencil tests, to determine if they're functioning within their expected range. If not, how severe is it, and help to characterize the different kind of cognitive difficulties they may have. Common is problems with learning and memory, slower thinking ability, some attention difficulties, problems with executive functioning like planning and organizing.
And now, do you take that information and pass it on to a neurologist on your team, or how does that work?
Well, what I do then is I prepare a comprehensive report and send that to the referring physician, and in that we'll have some diagnostic impressions to help determine if they're performing within the expected range, or if it's some mild cognitive impairment, which can happen with Parkinson's disease, particularly more earlier on, or if it's a dementia that's, and there's many different kinds of dementias, and then provide recommendations for the referring physician as well as the patients and families.
I see. Now, also besides Parkinson's disease, what are your other areas of interest?
Well, the patient populations that I work with mostly are traumatic brain injuries, from a mild traumatic brain injury like a concussion to more severe and profound impaired patients. Patients who have had strokes and other cerebrovascular events. Patients who have Alzheimer's and dementia. There's many different types of dementias, and some patients have just mild memory loss before they reach dementia, as well as Parkinson's and some other movement disorders. So those are typically the patient populations that I work mostly with.
What is so as a neuropsychologist, what is the age range of patients that you normally treat?
Well, for me, it's adults from typically about age 18 onward to patients into their 90s.
Oh wow! Okay, mm-hmm. That's a huge age range.
It is. So some neuropsychologists see from the entire age spectrum, from children all the way to older adults.
Now going back to concussions, do you ever see patients for sports-related concussions?
I don't. Typically, that takes place at the high school level, or involvement with one of the professional sports teams, which I'm not involved with. So I typically don't see the sports-related concussions. St. Mary's does have a concussion clinic, where a lot of those patients are typically seen with more of a pediatric focused team.
I see. Now, with concussions, this is what I wanted to get to. The patients that you're seeing, are these concussions that can be from a fall, or could be maybe a traffic accident or that kind of thing?
Exactly, David.
Okay.
So people that have had a slip and fall, or involved in a motor vehicle crash, or sometimes an accident, they fall off a ladder working, and suffer a mild traumatic brain injury or concussion.
I see. Now, in our neuropsychologist, is like a patient just walk in and see a neuropsychologist? Is that something you have to be referred to, or how does that work?
Typically, patients are referred by physicians such as a neurologist or a primary care physician, or psychiatrist or another psychologist, and most insurances do require a physician referral. It may be different if someone's a self-pay, they may be able to walk in then, but typically patients do have a referral.
I asked you this last time, but I want to ask it again now. I know there's a difference between psychologists and psychiatrists. Now, you're a licensed psychologist and a neuropsychologist. Now, do neuropsychologists prescribe medicine?
No, most do not. I do not prescribe medication, although there are some states that do offer that where psychologists can obtain prescription privileges.
I see. Yeah. So that may be something that you may be working on a team with a neurologist, and they may end up prescribing medicine in that case.
Exactly.
Okay.
Yes. Typically, there may be a prescribing physician who will then, take that role with the patients.
I see. Now, what type of schooling is required to become a neuropsychologist?
Well, a doctorate degree in clinical psychology, either a PhD or a PsyD, and then after that, 2 years of a postdoctoral residency focusing in clinical psychology.
I see.
Clinical neuropsychology, sorry.
Where did you do your residency for neuropsychology?
I completed my residency in Jacksonville, Florida at a rehab hospital, Brooks Rehabilitation Hospital.
Okay. Mm-hmm. And we mentioned before you're a licensed psychologist as well. Should people be seeing a neuropsychologist on a regular basis, like, we see our primary care or a cardiologist? Is this something that, you're referred to and kind of stay in a program because you have a certain ailment for a certain period of time?
Mm-hmm. Yeah, you may not necessarily need to follow up, as you would with your primary care physician. If a patient is referred to a neuropsychologist to evaluate their cognitive and emotional functioning, and if there are findings from that indicate follow-ups, then a patient may follow up for reevaluations and assessments and further recommendations.
All right, we're here with Dr. Nicholas DiPino, neuropsychologist and licensed psychologist at the Palm Beach Neuroscience Institute. The number there is to his office is 561-623-4980. Website's really easy to navigate, pbni.com. And Dr. DiPino's at St. Mary's Medical Center. That's St. Mary's, STMARYSMC.com. We're going to take a quick break, but on the other side, I want to talk to Dr. DiPino a little bit about dementia, traumatic brain injury, and some other areas of interest in neuropsychology on Doctors Are People Too.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm going to stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking. And all of a sudden, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red wine, that light red wine. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hello, South Florida and beyond. Welcome back to Doctors Are People Too. We're here with Dr. Nicholas DiPino, neuropsychologist and licensed psychologist with the Palm Beach Neuroscience Institute. Before the break, we almost got into what is dementia, but I wanted to ask you, because we talked last year, this was a huge topic because dementia was in the news last summer when the legendary Tennessee Vols women's basketball coach Pat Summitt died with early onset dementia. So just generally starting with this, what is dementia?
Dementia is a degenerative brain disease where patients experience thinking abilities, or a reduction of their thinking abilities to such a degree that it begins to impair their ability to take care of regular daily activities. They require assistance to care for themselves. And a lot of these dementias get worse over time, and there's an increased risk as we age. And there's several different types of dementia.
And early onset dementia, is that just to do with age, or is that different?
It is to do with age. Early onset dementias happen by definition before the age of 65, and these patients may be diagnosed as early as their 40s and 50s.
Now, are there signs and symptoms of dementia that I guess family members or loved ones or even friends can notice, and then maybe get the patient to a primary care and eventually referred to a neuropsychologist, neurologist?
Mm-hmm. Yeah, there are. I mean, it's important to keep in mind that as we age, we all have, lapses in memory from time to time, forget somebody's name, forget where we placed our keys. It's when it becomes a lot more frequent. Other people begin to notice it, and it becoming to the point where they're having difficulties caring for themselves, forgetting to take their medications, forgetting to pay bills or overpaying bills, making very poor decisions and problems with judgment. There can be some personality changes with mood, lack of interest, social withdrawal, inappropriate behaviors, and it becomes more of a concern for patients' families as they're seeing their loved ones deteriorate with this.
Now, can Parkinson's disease be related to dementia in any way? Is there any kind of connection there?
Yes, Parkinson's patients over time can progress to a dementia, Parkinson's disease dementia, to where their cognitive difficulties have become so significant that now they're, in the moderate to severely impaired range cognitively, perhaps, and they're having trouble caring for themselves, requiring more assistance from a loved one to, again, manage their medications or manage their finances. They may not be able to drive, and it's becoming worse over time.
Now, before we get off the subject of dementia, is there a truth to sundowning when the sunset starts and there's an effect in the way a person with dementia acts?
There is. And that can happen to older patients that have dementia. Later on in the day, in the evening hours, they may experience increased confusion and disorientation, possibly due to fatigue, or particularly if they're in an unfamiliar environment, they may experience the sundowning behaviors, yes.
We're here with Dr. Nicholas DiPino, neuropsychologist, licensed psychologist with the Palm Beach Neuroscience Institute. That's pbni.com. His number to his office is 561-623-4980. And he's on staff at St. Mary's Medical Center in West Palm Beach. That's stmarysmc.com, stmarysmc.com. I didn't ask you about your West Palm Beach office. Where's your West Palm Beach office located?
Well, it's on the campus of St. Mary's Medical Center for the time being. In fact, next week beginning next week, I'll be moving into the main office for Palm Beach Neuroscience Institute off Village Boulevard.
Okay.
And
Think
Palm Beach Lakes.
Okay, yeah, Village Boulevard right there in the big Publix Plaza.
Exactly, yes.
Okay, you're moving over there. Now you also have exciting news. You'll be opening an additional office in Boynton Beach also next week. So you're moving into 2 offices next week?
I am. It's going to be a little hectic end of this week and next week.
Wow, that's great though.
Yeah,
I mean,
you're very excited.
You're doubling office size.
Yes.
You're going to be in West Palm Beach and Boynton Beach.
Mm-hmm.
Now, that is the Canyon Town Center, west on Boynton Beach Boulevard. That's a really nice plaza there.
It's a very nice plaza, yes.
And I know that I was talking to someone about that zip code, and they told me that's one of the newest and most prestigious zip codes in the state because of all the building and everything going on out there. I don't know if that's true, but it's a really nice area.
Yeah, it's very nice.
So that's going to be next week. I believe I got the address here. It's 8756 Boynton Beach Boulevard, Suite 2300 in Boynton Beach. Like I said, the Canyon Town Center. So that'll be exciting news. And I'll give out your phone number. I'm not sure if you're going to have that same number, but your other number will be answered. It's 561-623-4980. Now, another topic I wanted to have you on the program to talk about is traumatic brain injury, which you actually wrote a blog on for the TFPS Health Spot. So you've written a few blogs for the TFPS Health Spot. You're a writer just like me. Now, what is traumatic brain injury, and do neuropsychologists also treat that the same way that they treat stroke?
Neuropsychologists are often involved in evaluating and providing treatment for patients with traumatic brain injuries and also with strokes. They may be seen in the hospital in acute rehab or as well as following them through the continuum of care into the office or in an outpatient clinic. Traumatic brain injuries are any kind of insult to the head that creates some kind of physiological change with the brain. You hear a lot more about mild traumatic brain injuries like concussions because of NFL and other high contact sports. But there can also be very severe traumatic brain injuries that can take place from motor vehicle accidents, which we see a lot down in this area.
Mm-hmm. Are there physical symptoms associated with TBI? I mean, is this something that you can notice?
There can be, yeah. Concussions and brain injuries do have some physical symptoms, everything from pain associated to the area of injury to other physical symptoms like headaches. People who have mild brain injuries may also have dizziness, nausea, vomiting. They may experience increased sensitivity to light and sound. They may have problems with sleep, mood changes, as well as the cognitive complaints with problems with trying to focus and remember things.
Now, can anxiety and depression also heighten with traumatic brain injury, or the acronym is TBI? I see that a lot.
Yes, emotional changes are common when patients have a traumatic brain injury. This may be due to the reaction to having it and adjusting to the injury, and patients have symptoms of depression or anxiety. And some other behavioral changes can take place, particularly with more severe traumatic brain injuries where there are neurobehavioral deficits where patients can become agitated and restless as they're more severely impaired.
Now we're here with Dr. Nicholas DiPino, neuropsychologist with the Palm Beach Neuroscience Institute. That's pbni.com. Number is 561-623-4980, and he has offices in West Palm Beach off of Village Boulevard, and then also starting next week in the Canyon Town Center off of West Boynton Beach Boulevard here in southern Palm Beach County. So now, how can a neuropsychologist help with multiple sclerosis? Because I know that's another one of the ways you can evaluate and come up with a plan for patients.
Mm-hmm. Well, patients who have multiple sclerosis may experience cognitive impairment, and this can be anything from some mild cognitive difficulties to more significant levels of it. And so a neuropsychologist may be asked to evaluate a patient to determine if they are having these difficulties, as well as clarifying if sometimes other factors contribute to this. So MS patients often have significant fatigue, and they may have depression and anxiety, which can also exacerbate some mild memory difficulties or attention difficulties. And some MS patients may also experience some of the signs and symptoms of dementia, like Alzheimer's, with significant forgetting and memory loss. So that's where a neuropsychologist may be asked to evaluate a MS patient, is to kind of clarify the picture with their cognitive functioning and also their emotional functioning.
Now, some of this testing, how long does it normally take before you come up, until you're done with your testing and evaluation? Is it different with Parkinson's disease versus dementia? Is there a certain time period that this is done in?
That's a good question, David. It's a little bit different depending on the patient and the referral question. Some of the testing can be relatively brief if it's for a patient who is more significantly impaired, either cognitively or overall what they can tolerate functionally. It may be only an hour or two. Some patients, it can be much longer, for 3 to 4 hours on average. Some patients may be closer to 7 hours, particularly if it's sometimes neuropsychologists do forensic evaluations, and they can be much longer. So it really depends. You tailor it for each patient, what you're trying to determine and what the patient is able to tolerate and what's most appropriate for them.
I see. And I know we only have a couple minutes here, but when you're not busy practicing neuropsychology, what are your hobbies and passions in life?
Well, I enjoy spending time with my wife and our family. We're fortunate to have most of our family in this area, so spending time together. I enjoy cooking, good food, good wine, exercise, and sports. Those would be some of my passions.
What is your favorite thing to cook?
Well, with a name like DiPino, mostly Italian.
Yeah. It's kind of like me.
Yes,
DiPino,
exactly.
DiPino, yeah. What is your favorite wine?
I would prefer a good Cabernet Sauvignon from maybe Napa.
Oh, nice.
Mm-hmm.
Mine would be Pinot Noir. Pinot Noir.
That's a very good wine, too. I do enjoy a good Pinot.
Yeah, Pinot from Willamette, Oregon. I like that area.
Yes.
And you mentioned sports. What are your favorite sports teams?
Well, growing up down here, I'm a big Dolphins fan.
Oh, good.
So we had season tickets. Yeah, they had a very good year.
Oh, you had season tickets this last year?
Well, no, growing up.
Oh, growing up, okay.
Back when they had Marino and Shula, we had season tickets. Now I watch the games with my dad at home, so we enjoy that together.
Yeah, I had season tickets for 1 year with my dad in 1992.
Oh, okay.
And I want to say Dan Marino was I know Dan Marino was there. And
yes, he would
the
have been.
Marx brothers.
Yes.
Clayton and Duper were there as well.
Yeah.
So that was
probably a good year for them.
Yeah, definitely. So, well, thanks again for coming on Doctors Are People Too. I really appreciate it. It's hard to believe that was 30 minutes, but we really talked about a lot of topics, and I do appreciate it.
Well, thank you for having me, David. My pleasure.
All right. And we'll be right back on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
Love Katie Cakes specializes in paleo, gluten-free, vegan, and regular sweets. Whether it's a cake, cookies, muffins, bites, or delicious treats, Love Katie Cakes is available for your special occasion. Katie DiPino is a certified pastry chef. Call her at 561-635-5831. It's Love Katie Cakes, LOVEKATIEKAKES @gmail.com, Facebook, and Instagram.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hello, South Florida and beyond, and welcome back to Doctors Are People Too. On our edition here on January 16th, 2017. I'm really excited to have on the program tonight Dr. Carlos Riveros, an internal medicine or internist on staff at Coral Gables Hospital. Dr. Riveros, how are you doing tonight?
Good, I'm good. How are you? Maybe
good.
In your program, I was hearing some of your concepts previously, and very interesting. You have a very interesting program.
Thank you very much. Yes, we had the neuropsychologist Dr. Nicholas DiPino on the program, and yeah, that was a really, really great interview. I'm really happy to bring doctors on the program to explain, the different health ailments, because it's great to have a doctor on the air. Now, you are on staff at Coral Gables Hospital, and you're calling from Miami, correct?
Correct, yeah. Coral Gables.
And that's at Coral Gables Hospital's 3100 Douglas Road, Coral Gables. The phone number to Coral Gables Hospital is 305-445-8461. I was talking with someone else today, and I told them that I'm having an internist on the program, and they were like, "Oh, you mean internal medicine?" But you're called an internal medicine or primary care physician, and also an internist, correct? I'm not wrong there, right?
Yeah, is that in other countries? When you say internal medicine, it's like say it's not specifically like a primary physician. Is like a more specialized person for general like the overall medical issues. I mean, no surgical, but medical issues. So everything that has to do with let's say neurology, pulmonology, gastroenterology, cardiology. So everything that is medical. So we are the persons to refer to, and then we can, if needed, we get support from other subspecialties that we need. But in other countries, the medicine is the structure of the services are different. I mean, there's general doctors that they study just to be general, like the family physicians. Let's say they cannot. I mean, they don't go to the hospitals, for example. They only have offices, and but the internists are the ones that act as the main person in the hospital. So it's a little bit different, the structure, but yes, I mean here the structure of a medicine is the internists became like primary physicians also. So we do that. We do primary physician. We do primary care also for patients.
I see. Thank you for explaining that. And unfortunately, one of the diseases that you are able to treat and manage is the word diabetes. It's far too common today. That's why I said unfortunately. Now there's so many definitions. So coming from a doctor, I wanted to have you on the program and ask you, what is diabetes?
Yeah, diabetes is something that we have to manage every day in our practices. And basically, diabetes is described like several diseases because it's a very, very complex situation where there's abnormal carbohydrate metabolism. To say it in easy words, complex abnormal sugar metabolism, and so that's ultimately characterized by hyperglycemia, which is high glucose or high sugar, let's say. So that would be the easiest way to explain it. But it's really a complex disease, or a complex situation. So it's associated with like an impairment of insulin secretion, but also resistance to the insulin, to the action of the insulin. So it's kind of a complex situation where the main issue is abnormal carbohydrate metabolism in the body.
Now, what exactly is insulin? I heard you mention that a few different times.
Yeah, the insulin is a hormone that is created by the body. I mean, the pancreas has a way to measure, let's say, and I'm trying to say this in words that everybody can understand. The pancreas kind of measure how is your sugar, and it creates this substance that is the insulin, and the insulin is designed specifically to go to the cells and, let's say, open a door of the cells, so those cells can get the sugar inside, because that sugar is what every cell needs to make energy. I mean, to function. In order to function, you need the energy. That energy is the way to have it is by metabolizing that sugar. So the insulin is the one that is in charge to open that door on the cells. So those cells can make an energy and function. Otherwise, they couldn't function.
Now, is there a way a primary care manages not only looking for things like pre-diabetes, but also managing diabetes? Is there a type of testing that you do every certain amount of months that can help to, give you as the physician a better understanding, but also give the patient some kind of numbers on ways to manage their disease?
Yeah, there's two things. One is when you have a diabetes already, and so there's some numbers that we manage. We can't speak about doing the diagnosis. That means what's the numbers that we use to diagnose, and the other thing is the numbers that we use to make sure that person is well controlled once the diagnosis is done in terms of diabetes. So we have terms like pre-diabetes and diabetes as a diagnosis. And so if you're looking for a person that is not already diagnosed as diabetic, so we look for numbers like the sugar in the morning, fasting. That means that you haven't eaten anything. It should be less than 100. That would be the fasting normal glucose. Then after 2 hours after you eat a meal, it should be less than 140. So that would be some numbers that we manage. In terms of a test that is called the A1C hemoglobin, which is glycohemoglobin, and that's really somebody smart discovered that the hemoglobin has some percentage of glucose attached to it. So it should be less than 5.7. That number, less than 5.7, that's the number for persons with no diabetes. So we can use those to determine if a person could be diabetic or could have like a risk of being diabetic. So that would be a normal person. So those tests are used to diagnose and also to manage then after the diagnosis is done. So the fasting glucose, for example, more than 126, that would be the number to diagnose the diabetes in persons. Taking this test twice at least in separate times, and the other one would be the A1C hemoglobin more than 6.5, or the test with the post 2 hours glucose post fasting after non-fasting more than 200. That would be the way to know if a person could be diabetic. I mean the way to diagnose the diabetes.
Now, how often are these A1C tests done? Is it every 3 months, 6 months, or is it on a case-by-case basis?
Yeah, for that test specifically, every 3 months is a good timing to do, because that's how long it takes to this glucose to get, to this hemoglobin to get rid of that glucose, or change in the glucose that is attached to that hemoglobin. So every 3 months for that, and that's a good test to follow a person that is diabetic, that is being diagnosed and treated for diabetes, and also I always it depends on how the patient is being managed. Let's say if a patient is on insulin or not, then you should also take all the tests like the fasting glucose at home, or tests done before the meals. It depends on how you're managing that patient. If a patient is in insulin, the testing should be more frequent. But if a patient is well controlled, let's say, you feel that the numbers are well controlled, every 3 months is good, and it could be also every 6 months if the patient has been well controlled for a good amount of time. So every case is different, but what we have to make sure is that you get a good control, and you can use any method you want to control it, but it should be well controlled. Because of the consequences of a glucose.
We're here with Dr. Carlos Riveras, internist on staff at Coral Gables Hospital. That's 3100 Douglas Road, Coral Gables. The number to the hospital is 305-445-8461. Now, Dr. Riveras, you have your own private practice near the hospital as well, correct?
Yeah, I have my practice just in front of the hospital.
Okay, and I have the address here. Correct me if I'm wrong, but it's 2601 Southwest 37th Avenue, Suite 702.
Correct. Yeah, that's the office.
And the number there to Dr. Riveras' office, across from Coral Gables Hospital, is 305-444-1213. Dr. Riveras, stay on the line. I want to take a quick break, but on the other side, have you back on to talk about the most common types of diabetes. Is diabetes reversible, hypertension, and if we get to it a little more into cholesterol as well on Doctors Are People Too.
Perfect. Excellent.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Shands, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. Also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back to Doctors Are People Too with Dr. Carlos Riveros, internist, with an office at 2601 Southwest 37th Avenue, Suite 702 in Miami, and on staff at Coral Gables Hospital. That's coralgableshospital.com. Dr. Riveros, before I have a couple more questions about diabetes and hypertension, but I'm looking at the picture of you here on the screen here in the studio, and you look like you're in great shape as a doctor. What do you do to stay in shape?
Yeah, usually, knowing all these concepts about the metabolism, diabetes, hyperlipidemia, and all these diseases that we could maintain under control, or at least delay the development. I always try to maintain a good amount of exercise, at least every day or every second day, every other day, and especially aerobic exercise. Myself, I try to do fast walking or slow running, at least during 20 minutes a day, and also play tennis because I like to play tennis. But I would say running or walking fast. That would be enough exercise daily to do and in a daily basis, and then during the weekend you can do more exercise. And the other thing is avoid to eat too much of carbohydrates. Like I reduce the amount of carbohydrates more. As much as I can, because I know it could be bad also for your health. The amount of salt also, to me, functions well. And if I maintain a good weight in physical activity, I always feel like energetic and I feel like a good shape. That's good. It's a good feeling, like psychologically and also physically.
There, you heard it first on Doctors Are People Too, right from a doctor, at least 20 minutes a day, and then more so on the weekends, or if you can fit it in, stay active. Now, going back to diabetes, I know pre-diabetes, I believe, is reversible. Is diabetes itself reversible?
Not really. I mean, when a person is already determined to be diabetic, well, that diagnosis is going to be there. Now, there's some situations where the diabetes is secondary to something. For example, a person that is receiving some kind of medications, medications like steroids, like prednisone or any other steroids, it could be that they develop diabetes while they're taking those medications. And then in that case, if the medication is stopped, most probably the diabetes will be resolved. But always it's going to be a risk of going back to diabetes. So if a person has none of those medications and develops a diabetes, even if it's not treated with medication, still continues being diabetic unless it could be only well controlled with diet and exercise. I mean, it doesn't mean that you need the medication to be treated. Sometimes you don't need the medication, and still you're diabetic, but well controlled on non-medication lifestyle modification. It's the same for hypertension, high blood pressure. If you're taking medication, I mean, by definition you're hypertensive, but it could be that you're well controlled without medication also, even if you have high blood pressure.
Now, one last question about diabetes. What are the most common types of diabetes that you see? Is it type 2? Is it type 1? Is it pre-diabetes?
Yeah, what is really, I mean, in terms of diabetes as a diagnosis, the one that you see the most is the type 2. And the type 2 is more related to high glucose, like hyperglycemia, and also the resistance to the insulin. It could be that you also have additionally low levels of insulin, but the resistance is the characteristic of the type 2. Now, the type 1 is more related to young people or like younger persons, and the characteristic is no insulin available in that pancreas. So the person needs the insulin. The other less frequent types, which would be the gestational or the diabetes that is presented during the pregnancy, like a second trimester of the pregnancy. Those are less frequent, but also happens and happens also like the type 2, which is more resistance, a little bit less or not enough insulin. The same characteristic, and there's other types of diabetes, which is like MODY, which is the maturity onset diabetes of the young. That also is more like a genetic dependent, and it presents during the young age, but it behaves as a type 2 also, mainly as a type 2. There's other uncommon immune mediated diabetes also, and less common. I mean, it behaves also as a type 2, but it's less common.
We're here with Dr. Carlos Riveras. He's an internist on staff at Coral Gables Hospital. The website there is coralgableshospital.com. And then also Dr. Riveros has a office, private practice across the street from the hospital at 2601 Southwest 37th Avenue, Suite 702 in Miami. The number there is 305-444-1213. Dr. Riveros, what is a question you wish more patients asked you in the office when they come to see you, or even in the hospital setting?
Yeah, I always hope I get happy when the person asks me, how can I prevent this to happen to me? I mean, that's a question that I would say makes me like more happy, because because that means that that person is interested on not on receiving treatment for something, but to avoid something. It's really the question that I like to hear from somebody before the disease is coming. People that pays attention to pay attention to the diseases in the family, for example. They say, well, in my family we have a type of cancer or diabetes or high blood pressure. How can I prevent or try to prevent that to happen to me or to my child? So I mean, those are the kind of questions like prevention. That would be, and I spend a lot of time with the patients trying to explain about the disease, and so they can participate on that prevention, and they understand why they should be active, trying to prevent or avoid the complications. Because one of the things to prevent is really the complications of diseases as diabetes or high blood pressure, etc. So prevention is the question that I like to hear the most.
Dr. Carlos Riveros, it's hard to believe, but we're just about out of time. Thank you again for giving us so much information on diabetes. Very important. I'd love to have you on the program again. Thank you.
Thank you very much.
Have a good night on Doctors Are People Too.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.